All right, so thank you, everyone. You can continue entering in your credentials in the chat, but we're going to get started here on POWTS chat today. So welcome. It's a beautiful day in March. I'm so grateful that you could all join us. Today, we're going to have a couple of special guests. So the agenda today, we're going to have two speakers on occupational health. So Sheryl Bedno and Bruce Miners, both from the Department of Health, and they're going to speak to some of the occupational health things about that could affect POWTS. And then there'll also be a second portion of the POWTS chat, which is just the general POWTS update from POWTS staff. Josh Rowley, who you all know, will be speaking, and I'll do a little bit on plan review just to update you guys on how the season is going. So before we get started, I'd like to just briefly introduce our guest speakers. So our first speaker will be Dr. Sheryl Bedno, who's the Chief Medical Officer and State Epidemiologist with the Department of Health Services, Bureau of Environmental and Occupational Health. I apologize if my internet connection is a little bit unstable. She joined the department in July 2023, but has spent most of her career with the federal government, most recently serving as the Senior Occupational Medicine Consultant with the United States Department of State. She also served 20 years with the U.S. Army, where she served multiple public health, occupational health, research assignments, things like that, and was deployed to Afghanistan and worked in Kenya. We're very grateful to have her join our team at the state of Wisconsin and grateful to have her here today. Our second speaker will be Bruce Miners, who is the Legionella Industrial Hygienist for the Wisconsin Department of Health Services. Since 2017, he's been conducting Legionella environmental assessments and sampling, and along with doing education for local health departments, plumbers, and facilities. He's been with DHS for about 2 years, but prior to that, he was on loan from DSPS, which is where most of you probably know him from. So prior to going over to DHS, he spent 15 years in the as a plumbing and public swimming pools consultant with DSPS. He's been in the plumbing industry since 1985 as a master plumber, cross-connection control tester, and designer of engineered systems. So we're super grateful to have them here today, and we'll get started here with Sheryl.
Okay, hopefully everybody can hear me. I just have a few remarks, and then Bruce will take over. I really want to start by talking about what is occupational health and what occupational health physicians do. We are medical providers who focus on workers, the workplace injuries and illnesses, and also ways to mitigate those risks. And I think what's also important is who we work with in accomplishing that mission. We work with people like Bruce, an industrial hygienist, who evaluate the risks in the workplace. And the various hazards depend on the environment, and everybody's work environment is unique. So it's really important to look at one's own environment and assess what could be the different hazards in one's workplace. And so Bruce is going to talk about Legionella. And so there can be biological hazards in your environment, and they can be transmitted through contact, so touching. It could be through airborne, breathing them in. And some of these may or may not be associated with human health or could lead to illness. And there can also be chemical hazards, and that can be from cleaning products, the products you use to keep things clean, and other things that can cause, they can be irritants to skin, eyes, respiratory systems. And I also want to mention the one that I probably see the most in my clinical setting is physical hazards. Lifting, working around sharp objects, confined spaces, slips, trips, and falls. I mean, these happen on a regular basis, and then that kind of leads me to, how are these things prevented? And I mean, what I'm going to tell you next seems like it's such common sense, and you'll think to yourselves like, yeah, of course, these are things that I do anyway. But, most of the things that I've seen in the past in occupational health clinic settings are because there were, lapses in protection. People became complacent, like, oh, I don't need to wear my full personal protective equipment. May forget to wash hands or do, different forms of hygiene. Lapses in training, or may not be aware of what could be various hazards. And then, of course, just making sure the area around you is a safe work practice. So I think, I think lessons learned just from seeing people with work-related injuries and illnesses is that in most cases, I could identify what went wrong. And that leads me to say, hey, these things, if something, they can be prevented. And that's really all I have to say. And I'm going to have Bruce proceed with his presentation.
Thank you, Cheryl. All right, Bruce, I am going to stop sharing my screen so that you can share yours. Thank you, Bruce. Oh, but if you're talking, we can't hear you if you're muted. I'm not sure.
How about now? Can you hear me now?
I can, yes. Thank you.
All right. I was moving things around and realized I was on mute yet. So good morning, everybody. My name is Bruce Miners. I'm a Legionella industrial hygienist for the Department of Health Services. I work in the Division of Public Health. My job is working and chasing Legionella and trying to prevent it within the state of Wisconsin. So I'm on the Wisconsin Legionella team, of which there's two of us that are full-time, and that would be Francis Golio and myself. And Francis is the surveillance coordinator. She's an epi. She's also a veterinarian, but she's an epi, and she works closely with like the CDC, other states, because we get, interstate travel, things like that. She does all the coordinating stuff to try to figure out where this stuff comes from. I'm more the boots on the ground kind of guy and the education side of it. So I could not, absolutely not do my job without Francis. And then there's Anna Kocharian, who's an epidemiologist. She's the one that actually has been doing this the longest. She's kind of stepped back, so she's not full-time doing this, but she's the one that got me dragged into this in 2017 when she approached DSPS and Tom Brown. And then that's kind of how I ended up in the Legionella world, is through Anna. She has stepped back because she's a senior epidemiologist, so she deals with monkeypox and Ebola and all this other crazy diseases that we see that we're continuously threatened with. So she's kind of on the cutting edge of all that. And then Charlie Clark is our supervisor, unit supervisor. We're in the enteric, so that's the any food poisoning, things like that. There's a lot of more of that happens than you realize. And he's the supervisor, and he's very proactive like me. And I get out and do a lot of instruction, a lot of teaching. So like when I'm done with this, I'm jumping in the car. I'm heading to the Dells. I'm sitting in the Wisconsin Healthcare Engineers Association meeting for 4 hours. Then I drive to Oak Creek, and then I teach there tomorrow. And then Thursday I'm teaching up in Stevens Point. And next week I'm going to be teaching. So I've been continuously teaching on the road teaching. So I teach general plumbing for education. So I have between a 2 and a 4 hour class I teach. I also teach plumbing apprentices, and I'm doing quite a bit of that. I did last year. I'm doing a lot of it this year. So I'm trying to get in and teach 4th year plumbing apprentices, and that's healthcare plumbing and Legionella, and that's 4 to 6 hours I teach. And so it's keeps me quite busy. So my experience, as she says, I've been 23 years in the field as a plumber, owner designer, 15 years at DSPS, and 2 years at now, almost 2 years at the Department of Health Services Division of Public Health. I love it here. Great place to work. So plumbers, I just got to throw this in. Again, this is part of my, I've taken stuff out of my 4-hour presentation, and I'm condensing it down. And plumbers protect the health of the nation. Okay. And there's a quote here: passive protection against health hazards is the best way to improve population health. Now, I know, get a little off track here, but it was just to let plumbing industry know. So there was a survey done of the last 147 years by the British Medical Journal. And they did a survey, and they did a survey, what was the biggest thing that impacted people's lives in this world, right? And it's sanitation, it's plumbing. It beat out antibiotics, it beat out everything else. Sanitation has improved the health of this nation, generally most of the world, is due to plumbing. So I put that in there, and it's part of what I want to tell plumbers. I mean, anybody that is credentialed, whether it's a full master plumbing credential or it's the more limited credential for doing septics, it's all the same. It's all part of public health. What everybody does matters. You can pollute the groundwater, you can cause cross contaminations, you can, what if you don't do your job right, you can kill people. I know, but part of what we're talking about today is protection of your health. But I just got to call out that it's more than paydays on Friday and it runs downhill. It's everybody here listening is very important to the health of the world and of this country. So you can just go into any third world country, and their biggest problem is sanitation, right? And they're dealing with the diarrhea, and they're dealing with all these things that we don't have to deal with. And it all has to do with basically great sanitation and great water quality. So what's Legionella? Legionella is a bacteria found naturally in fresh water. So it's found all around, right? There are about 60 species of Legionella bacteria. About 1/3 of the species cause disease. And Legionella can become a public health problem when it is in a man-made water system. Now, that's either in a water distribution system, in a fountain, in a hot tub, in these decorative water walls, anything that can create, it's man-made. Now, Legionella grows between 77 degrees and about 115, all right? And it grows very actively. So when it gets into a warm system, it can grow. And so when it gets into warm water, like a hot tub. So when if you're sitting in a hot tub that's at 103 degrees, you can't sit in there very long, but I can tell you the bacteria is having a grand old time. It's multiplying and growing if it's no disinfectant in it. And it also can stay in ice. Can't grow in ice, but it can get encapsulated in ice. So when I do investigations, I actually take ice samples. So when I do my work, I chase Legionella. So when there's outbreaks, and I chase it and I do sampling and I try to figure out what went wrong in a building. And it's cooling towers also. So I'm up in cooling towers checking those. And the other part of what I do is education, what I just talked about. And then the third thing that I do is I've done 14 of them so far this last year was I go out and I do buildings that don't have any clinical case. I just walk through the building and try to figure out how to prevent it. Usually it's older healthcare buildings, like older nursing homes. But I went through a brand new ER just last week and found issues in a brand new ER. Hasn't even been opened yet, walked through it. So I'm called in to consult and try to prevent the disease. So Legionella disease is on the rise. So the numbers are up, and it's going up, as you can see here. Our numbers were down a little bit last year. It was a very dry year. No science to it, but I think my opinion is that the humidity has a lot to do with that. And so when you get like cooling towers and things like that, the humidity, because Legionella needs water. If you pour a glass full of highly contaminated water with Legionella, you put it on the countertop or on the ground, and it dries out, it's dead. It needs water. So when you have high humidity, I think that has a lot to it, because from a cooling tower, it can carry, for up to a mile. So if you got a nice humid day, it can carry, it can drift for a mile and infect somebody a mile away. When you go the highest parts of the country, you can see Wisconsin, Michigan, Ohio, New York. These, kind of like the Rust Belt, they used to call it. We're the highest states. We have the highest Legionella in the country. Wisconsin, Michigan, Pennsylvania. Then as the colors get lighter, it's less. But we're seeing a lot of that, and so yes, we are very high rates of Legionella in the state. What is Legionella? Legionella is a pneumonia. It's a cough, fever, muscle aches, shortness of breath, chest pain, headache, confusion, and diarrhea. Pontiac fever is another disease you can get from the Legionella bacteria. That's no pneumonia. It's mild illness. It gets confused with the flu. Its chances are, of the people listening, somebody has had Pontiac fever, but it's self-limiting. It doesn't need anything to treat it. But it makes you sick for quite a while. But now with everything else, with all the other diseases that kind of have the same symptoms as Pontiac fever. So I normally don't chase Pontiac fever unless it's part of an outbreak of Legionnaire's disease or Legionellosis. I had that in a factory where they had, we had Legionnaire's disease and we had a pile of people with Pontiac fever. And so that's about the only time I really get involved with it. Otherwise, you normally don't find out about it. But here's, so why are we so worried about it? Why do we have 2 full-time people at Department of Health Services working with this? It's because in the general population, between 10 and 15% of the people that get Legionella die from it. So it's got a very high fatality rate. And so that gets everybody's concern, right? So you don't want to avoid an outbreak, like there has been. I mean, there's been outbreaks. There's one going on in Poland right now. A lot of fatalities. So it's that's why it gets our attention, and it really gets our attention when you get into healthcare associated Legionnaire's disease or Legionellosis, and that's 25 to 30%. That's a high fatality rate. In other words, if we get 10 people that end up within a nursing home, a good possibility 3 of the 10 will pass away. And in the general population, we're going to get 1 out of 10, maybe more than that, that'll pass away. Usually when you get in the general population, when it usually attacks people that are older, 50 years old or older. But when you get to the people in their 40s and 30s and early 50s, and it's usually former smokers or smokers are really susceptible, can really get it. And then if somebody has COPD or any other kind of lung issues, or they're on certain medications, they're more susceptible. About nearly half of the Legionella outbreak investigations that I do are in long-term care, so healthcare facilities. So usually it's assisted living, CBRFs, nursing homes. Is about 44% of what I chase that I actually do investigations. Lodging is about 30%. Hotels, timeshares, things like that. That's about 30% of what I've seen. So we actually go investigate hotels where they had Legionella inside of a hotel. And then other is community. Other is the hardest to do because that's coming from cooling towers. That's a little harder to track. Usually I'm on Google Earth trying to figure out where this stuff is coming from. And it's a little harder to get access to cooling towers because it contaminates a community versus, when you're in a building, we know it's, a building. So it's a little tougher to do. So why am I talking to you? Okay, so a lot of, 'cause I was asked to do this, and I know most of the folks here do exterior work. And so there's really no association that I've seen with Legionella and septic tanks or pumping chambers or anything like that. There's no science on it. Not saying it couldn't happen, but there's no science on that. So the reason we're talking and we just wanted to was asked to talk is that a lot of the people that are listening are credentialed that can do interior work, right? So some do interior or can do interior and exterior, and some are exterior. So if for the people that can come in and work on hot water distribution systems, we find one of the biggest smoking guns that cause this, that can cause it, is expansion tanks. So hot water expansion tanks. Now we have expansion tanks on the well, on the and a lot of you are credentialed by the DNR. I used to be. I just gave that license up a couple of years ago. And we have that cold water expansion tank, either buried or it's right inside the basement wall usually. There's no studies saying that there's ever been Legionella outbreak from there. Not saying there isn't. There's just no articles or science to it. I know when I had my my DNR credential for a long time. I know they had talked about bacteria growing in those expansion tanks coming from the well, and that can be a problem. When you have Legionella in a building, it's seeded by the well or the municipal water system. I mean, that's where it comes from. It comes from the water entering the building is how it gets into the water distribution system in the building, or how, when you fill your hot tub, or when that it's getting seeded from that. So it's in the well, or it's in the surface water that the municipality takes in. So there's a good chance that there could be Legionella in that expansion tank, but at that point, Legionella becomes dormant under 77 degrees. So if there is Legionella in that expansion tank, more than likely it could be there. Good chances are there's some, that is in that, but it would be more of in a dormant state. That's when you get into, like I said, 77 degrees or warmer, it takes off and amplifies. We call it amplify, and it amplifies quick, and that becomes a problem. So you have your expansion tank, then you have your showers, anything it can aerosolize, right? You're breathing in the droplets, it gets into your lungs, or you aspirate it into your lungs. So if you're drinking a glass of water or chewing on some ice that has Legionella in it, and you suck in air as you're chewing on the ice, it gets into your lungs, whether you're drinking something or, like, say, chewing on ice or something like that. So you can get infected from drinking something that way, or, like I said, showering is the biggest thing. When it's in the water distribution system, then obviously we talked about cooling towers, because that's a mist of water coming out of a cooling tower continuously. And then you have your faucets will aerate, like I have my kitchen faucet. I'm on the west side. My kitchen faucet's on the west side of my house. When the sun is setting and it's just right, and I turn on the water, I can see this big plume of fine water mist around my kitchen faucet, right? I normally can't see it, but the sun comes in right. So that's a mist of water. If that had Legionella in it and I breathed it in, I could be infected. So here's your expansion tanks. Both of these expansion tanks, and I've seen many of these, but these two are quote unquote smoking guns. Both of these tanks killed people, basically, are responsible for that. So you got an expansion tank here on the left. This was last year. So the water in that tank is 13 years old, right? 2023 to 2010. That water is highly, this water was highly contaminated. I took a sample out of that. The colony forming units were crazy high. And then on the right came out of a hotel. That was a couple years ago, but the water in that tank was over 20 years old. There's 10 feet of piping to it. So how does this concern you? Again, aerosolization. You can infect yourself or other people by mishandling these old tanks. So it's breathing in the water, having anything aerosolized, and it doesn't take much. So if you're working on these tanks, I would recommend wearing a fitted N95 mask. It's not that big of a deal, a N95 mask. If it's fitted, and I say fitted, so it's tight, I have to have a fitted mask. I have to have a smoke test, but if any kind of an N95, if you're fitted or not, I would recommend doing that. If you're a smoker, you're a little more higher susceptible if you're working around this stuff than if you're not a smoker. So the positivity rate at the point of use was high at these facilities where these tanks were. So we had really high positivity rates and we had fatalities. Right now in the Wisconsin code, that was part of the plumbing code committee. In healthcare, just healthcare now, these kind of tanks are no longer compliant. They have to, it's called flow through expansion tanks. It's kind of, basically like a water heater, kind of, just to make it in simplistic, you got water flowing in and out of these tanks continuously. They're no longer dead ends. So again, expansion tanks can serve as a dead end in the hot water distribution system, seeding the system with Legionella. As of, okay, I got ahead of myself. As of October 1st, 2023, the Wisconsin Plumbing requires new and replacement expansion tanks in healthcare facilities to be of the flow through design. They're made. This is a normal one. This is not a flow through one, by the way. So there should be an X through this one, right? Yes. So this is no longer, compliant in healthcare. It's a reason they make them. Wisconsin is the first state in the country to do this. Others will follow. I was asked to, in the UPC, the Uniform Plumbing Code, I actually did this as a code suggestion to the Uniform Plumbing Code, along with about 10 other items that we took from the Wisconsin code and proposed them into the UP's Uniform Plumbing Code. So this is just, expansion tanks on the right, the two on the right here, you can see that's your traditional. The two on the left is one type of flow through expansion tank. So these are the ones on the left just kind of are, piped in generally. Those are smaller ones. Then you get the big ones like Takeo makes these big one floor mount that are flow through also. So these have been made. I mean, and they're made for Legionella. Other countries, I'm on IAPMO and ASPE, and I'm on a bunch of privilege of being on a lot of different of organizations. And you go to Europe and some of these countries, they're way ahead of us on a lot of this stuff. And so this stuff has been made for Legionella. It's just that the United States hasn't picked it up yet. And Wisconsin, hats off, is the first in the country to do. And I was told, if now that Wisconsin did it, other states will follow. And this is just the actual code language, right? Expansion tanks installed in hot water distribution systems shall be of the flow through type. So expansion tanks are a known source of Legionella. Again, they're an amplifier. They're a dead end. They're in a nice warm room. So you get a little Legionella in there and the bacteria takes off and grows. But not every tank would be contaminated. But just saying that there has been a lot of them that have. So care to protect the person removing and replacing the tanks along with the occupants in the building. So if you're in a nursing home or something in healthcare, or if you're in somebody's, somebody, you don't normally see a expansion tank in the hot water distribution system in a house unless you get some of these, high-end houses will have them. But, just bag it up, treat it as hazardous waste in the sense so you're not exposing people, especially in a healthcare facility. So aerosolization of the water within the tank is the danger. And then a minimum of a fitted N95 mask is recommended for anybody working with old hot water expansion tanks. Again, if you get an expansion tank, that's under the DNR regulation or under the DNR's control, the expansion tank there, whether it's buried or in the building, again, no paper I've seen on that. Chances are there could be, like I said, it's seeded. Chances are there could be Legionella in it, but it's not amplified because of the cold temperatures. There could be live bacteria in there, but maybe not in such numbers that is a danger at all. Nothing that I've seen. And that's it.
Thank you, Bruce. Really appreciate both you and Sheryl coming on to talk to us today. If anyone has questions for Bruce, you can either enter them into the chat or unmute yourself and ask. We'll give it a minute here. Otherwise, we're going to move on to the DSPS portion of the talk. Okay, so there is a question in the chat, Bruce. does chlorine not kill Legionnaires? What is can you talk a little bit about, treatment of it?
Absolutely. So when we get it in a building, and let's say in the distribution system, or let's say it's in a hot tub or whatever, in a hotel pool, yeah, it's called remediation, and you can remediate by hyperchlorination. That can be really tough to do because Legionella, there's stuff called biofilm, and there's amoeba, and there's things, and the Legionella is really, really good at hiding within this stuff. And the biofilm, the slime, protects it. So chlorine can kill it. So in the Wisconsin Plumbing Code in 3D250 3B6 point, like when you talk about healthcare, there has to be in the hot water distribution system, there has to be a disinfection, or they used to call it bacterial control before the code change. And that's continuous in the premise plumbing hot water distribution system. And one of the options, you can do it thermally. One is chemically, which is chlorine, monochloramines, or there's another chemical that can do that also, chlorine dioxide. And so let's say you just go do chlorine. Well, you can inject chlorine in, and we try to have, what is that? It's required to have a 0.5 free chlorine residual. And that 0.5 free chlorine residual means it's free chlorine. It's free. It's not being used, not used up. And when I say distal fixture, that's the farthest fixture. And it's floating around there at at 0.5 parts per million minimum. And it's floating around. So then if any bacteria from the biofilm gets released, or something new comes in for the municipal system, that chlorine can kill it, or any other bacteria, or organic matter that's in because chlorine also reacts with organic matter, right? And so yes, it can kill it. But the problem is in a normal system, that works really good because the code, that's what we want in the code, right? I came from general plumbing. That's what we want. The problem is if you overwhelm the system, we call that a sloughing event. So like some construction or something like that, and all of a sudden a whole bunch of stuff would slough off. That's what happened in Michigan, right? At Flint, Michigan, right? There was a lot of Legionella. A lot of people died from Legionella in Flint, Michigan. Not just from there was the lead issue, but there was a Legionella issue. There's two issues going on in Flint. And what happened is that because of the change of water, it caused all this biofilm to peel out of these complex water distribution systems in these buildings. And all of a sudden, we call that a sloughing event. It was causing a sloughing event. And when it sloughed, all this Legionella, all of a sudden, boom, it was in the piping system and overwhelmed the piping system, and people used new water, ended up with Legionella. And, like we said, 10 to 30% of the people will die from it. And so that's part of the big problem that was in Flint, Michigan. So when I teach water management programs, I teach the surveyors that go in and survey healthcare facilities. And part of what's in a water management program is we say, you got to be aware of construction in a building, not just plumbing construction, but anything that would vibrate, shake the pipes, anything like that. So yes, chlorine will kill it. We call that hyperchlorination. If you have a building, that has you have an outbreak in a building, you have to remediate. And then generally chlorine will kill it unless you overwhelm the system. Then chlorine just can't keep up.
Thank you, Bruce. All right, so I am going to share my screen, and I will only talk very, very briefly here, but then we'll swap it over to Josh. All right, so I just wanted to talk very briefly about plan review because, typically we don't talk about plan review a lot, but this season has been very anomalous. And so I thought it important to just talk a little bit about how things are going so far in March. So in terms of DSPS POWTS plan review, so far in March, when I looked this morning, this number might be higher now, but 81 plans have been approved. And there's 110 plans in the queue, and we're about 9 days out from submission to review. So those numbers might seem to you guys, you don't know the difference, but to us, it's a little strange. Typically in March, we don't have this many plan reviews coming in and out of the door. And I think it has something to do with the spring. So I just wanted to touch on that and say that the numbers right now in March look much more like they do in June. So yesterday I counted and 20 plans were submitted, which is much more similar to the numbers that we would be seeing in a typical year in June. And in February, the number of plan reviews was up 25%. So I guess plan for a busy year. We're planning for a busy year. We're excited to have 2 additional plan reviewers to help us out. And I think we will definitely need it. So I'm going to stop sharing my screen and Josh can share his. All right. And Josh, I don't know if you're talking, but if you are, I cannot hear you.
I bet you can now. Can you guys see the sledgehammer approval?
Yep, I can.
Okay, good. So as everybody's aware, or most people are aware, we're redrafting product approvals for pre-treatment devices to clean up the language in there and clarify any misconceptions on what approvals are for. Sledgehammer is the first one that has been cleaned up. And if you are familiar with sledgehammers, you'll know that their past approval was for an S46 and for an S86. Now you'll see the approvals are for a specific model, the S400, the S600, S800, and S1000. We tried to clean up and simplify the approval letter, so when you look at them, you'll see right away what they're good for. For example, these devices are approved for residential strength wastewater only. Effluent from these devices shall conform to the following parameters for BOD and TSS less than or equal to 30. And because it's pre-treatment, if they're utilizing it as a device for effluent 2, it has to utilize pressure distribution. Added a tank table here. If somebody's looking at, say, an S400, the treatment capacity of the 400 is only 400 gallons per day. The first tank is going to be 1,000 gallon minimum capacity, the second tank 500. So you'll see that for each one of the devices. Cleaned up the language from table 4. They get a BOD credit for downsizing the distribution area. No fecal reduction credits at all. If pre-treatment is being utilized and they want to add UV, that a fecal reduction credit is going to come from the utilization of a disinfection unit, unless the manufacturer has a specific package that includes UV. The pre-treatment devices will show that they are not eligible for fecal reduction. Again, that will come if somebody were to add a UV lamp, for example. The fecal reduction would come from that addition of the lamp. Also on the approval letters, showing what's required for the components. In the past, we've had products installed where maybe not all the components were being installed that were tested through NSF. This will help clear that up for any counties if they're out on a job site. You know, if somebody's putting an S600 in, you'll see the design flow 600 gallons per day. They need 2 S86 ABG units. They'll need 2 air pumps, single basin. The matrix stack 6 tier, 24-inch diameter actually sits on top of the ABG unit. So you'll have 2 stacks. The matrix float 6 panel. That's the panels hanging near the unit. Or it could be a 7, depending on the size. You see the 1000 requires 7 panels. The max curtain, there's one of those. That's this V-shaped dotted line. That's how the curtain will be installed in the tank. And then obviously the bacterial blend, there'll be one for each unit. And then they spec out the GF10-8 filter or the lifetime LT116 filter. So you can kind of see right from the approval letter on what is required for each unit. And then we also added the language, a manufacturer rep shall be on site to train each installer during their first installation to ensure the system is installed correctly, which is specifically important here because you're adding a number of additional components that were never required or installed in the past, to my knowledge, in this case with a sledgehammer. So moving forward, whenever you guys are looking up pre-treatment products, you will hopefully see a much cleaner letter that's going to lay out everything that's required as part of what was approved through NSF testing. Part of that letter too, we have the installation manual. So again, you can kind of double check everything, make sure that what's being installed meets the standard for the NSF 40, if it's a 40 or 245. Again, our components here, so you can kind of see what's going on. It's important too with these, you know, again, they're talking about the first chamber. This is where the ABG unit goes. The second chamber is a clarifier or a settling chamber. So if you're going to have, obviously with these pressure distribution, you'll actually have to have a third tank or a additional tank that's going to be your pump chamber. That won't be part of the 500-gallon settling chamber or 667. It literally is a standalone pump chamber, which is a little bit different too than what everybody's used to seeing for the ABG units. And then they just give a kind of a quick rundown. I would recommend familiarizing yourself with the approval and the installation if these units are common in your area. They're definitely more common in some areas than other areas. We're also always available too. If you're going out on a pre-treatment installation, you're welcome to reach out to me or whoever you can get a hold of in the department. If you have any specific questions prior to going out or when you're on site, we can walk you through most questions that you'll have. We should be able to answer for you. Again, they're just going through different installations. This is the stack that goes above each unit. These are the curtains that kind of hang in the tank between the units right here, the float matrix. Then you've got your stack installation again, and hopefully everybody's going, wow, this is a lot better to understand than the old approval letters. We wanted to take the guesswork out of everything and eliminate confusion by listing effluent water quality standards. Just because the standard was there and a product was approved, the product has to meet that approval. One thing that we do need to discuss too, any state approved plans that have, for example, a sledgehammer. If the state has approved the plan, but there hasn't been a county permit issued yet, the county permits will be issued off of the state approval. So even though now the product approval has changed, the existing state approvals will still need to be honored by the counties. Moving forward, anything that were to come into the state, you know, we're going to require the new standard be met on what type of systems being specified. Same if a county has agent status and you get a pre-treatment unit in there. Moving forward, if it doesn't already have state approval and it's coming into your office, let's say you get a submission today for a sledgehammer S600, it needs to comply to these standards. This went into effect on February 29th when the letter was drafted and put forward. If county is getting any applications and they have questions, please reach out to us and we can go over that on a one-to-one basis or whatever you're going to need. Any questions so far on here?
If folks have questions, you're welcome to unmute yourself and ask or enter them into the chat. I did see a comment, Josh, saying great job, much easier to understand and see what is needed. So I'm glad that people are seeing that it's seeing the efforts and that they're more useful, I guess.
Right. You know, and then here's another example too. If they're installing the S600, you can flip to the appendix. This gives you a side profile. The important thing to realize here is this matrix curtain. They're just showing it as a, you know, the single view here. This curtain will actually come forward. It'll cover up, you know, come past some of these other components that are in the tank. So with it being, you know, kind of a new setup, that's again why we're wanting the manufacturer or rep to be on site to walk through the installation of these individual components for these systems to make sure they're set up properly and then working properly also. Hopefully, as you guys scroll through these, you're going to see how all these changes are making a positive impact on the products themselves. Here we also added cut sheets. We're going to do the same thing for each product. One thing to keep in mind too is I've talked to a couple of manufacturers that don't have any product certifications or third-party testing. Products that you may have issued permits for or that you've seen go in the ground in the past, into the tanks for pretreatment units. Those may end up being utilized specifically for restoration, and those wouldn't be allowed as a pretreatment device. So you'll definitely want to stay up on approvals as they come out. Starting March 29th, end of the day, that's when you're going to start seeing product approvals changing. The product approval, if you go to our website and search it, it's going to show that the product is there, but if the letter hasn't been corrected yet, you won't be able to read what the product parameters are. So if you have a question on a specific product, I would say please reach out to me and we can walk through what those amended approvals are going to look like. If manufacturers don't respond to the information requests that they were sent out in January, their approvals will just be changed to reflect whatever data we have. And if we have no data, they potentially could become delisted. We'll cross that bridge when we get there. But as we get new product approval letters drafted, I'll send them out to my coworkers and then they'll reach out to district reps and get those out. And then if you guys could forward those on also to whoever else is, within your district for WCCA and spread the word, that would be fantastic. Changing letters doesn't do us a lot of good if everybody's not on board and if people don't realize the changes that have taken place. Another nice view of cut sheets here showing you kind of what's going on with different aspects of the product. So this is just their official listing that their products meet the NSF Class 1 standard. And then this is just a brief overview of their revised NSF information. It's available here. Anybody can look it up if you'd like. We are going to be changing our categories when you look stuff up in ISLA also to simplify it. Our hopes are instead of tier 1, tier 2, and tier 3, those are irrelevant categories to actually just list specifically POWTS pretreatment or mechanical pretreatment. So you can go in there and look in the pretreatment file and see the manufacturers and the products. You'll still be able to search by manufacturer. If that's what you've done in the past, you'll still be able to do that. Filters will have their own category too and simplified. So we're hoping to make it an easier experience when you're looking up products so you don't have to try and guess where something's at, which will make that a lot easier. I see Laura's question here. So this would be under Sledgehammer and it would be under pretreatment devices. I can give you the exact location here. Give me a second. So our location too, and that's one thing in the past too. So it's where they get located within ISLA is dependent upon particular keywords that the manufacturer may use. And that's why in the past, some of these have not necessarily been where you expected to find them. So if you were to go into public lookup right now and type in Sledgehammer, you'll see this particular product come up. The documents are available. You can go in and click view on the available documents and the approval will load right up for you. If you have a hard time getting an approval to load, let me know. There's been some issues where an approval's been available one day and gone the next. If that's brought to my attention, I can re-upload the approval or submit a new link for that approval letter also, and the product information that is relevant to the approval. Any questions on these revised approval letters yet? Or if anybody has suggestions on better ways to get the information out when these approvals are issued, we're all ears on that also, because a big part's going to be awareness. And we realize that people are not going to naturally know this. Your plumbers aren't going to necessarily know that the product approvals have changed. It's going to come from manufacturers and from sales reps to let everybody know that these have had some substantial changes to them.
So I see a note there from Laura. DSPS has an email option on their webpage. Could you use that for updates? I would expect that, because we don't like to abuse that system, because it goes out to around 3,000 to 4,000 emails, that when the dust is settled, we'll probably send out an email blast with that information. Would that be correct, Josh?
Yes. Yep. In the beginning, these are going to be, you know, 1 a day, 2 a day, as we're drafting the letters and digging into the data that we have, to ensure that they're categorized properly. So, yeah, I mean, we can definitely do that at the end. Send an email out with a link to public lookup with a little brief description on how people can even look up products. I mean, we could do that. It'd probably be beneficial. A lot of the training events we've been at, and spoke at for First Supply, asking plumbers and designers how many people can look up products. A lot of people didn't even know that was an option. So again, education and trying to get people to understand the value of looking products up is going to be huge. And I do know there are a number of, from what I'm gathering, there are several state approvals that are floating around that don't have county permits yet for pretreatment units that will be in all likelihood changing. So again, if it's got a state approval, you could issue it based on the state approval. Otherwise, if you have questions, like I said, please give us a call and we can walk through any questions you have on those products. And nobody has any questions?
That's all right. If folks have questions, please feel free to unmute yourself and ask. Otherwise, I think unless Josh has more to talk about, this will probably be it for POWTS chat today. It is sunny and beautiful up here in Superior, 65 degrees. So use your 6 minutes to get outside and see some sunshine. People can start entering their name and credential into the chat to sign out. And I'd just like to thank everyone for their attendance and welcome spring. I'm excited. It's going to be a very, very busy year.